It was established about 40 years ago, and it was established, interestingly, by our founder, Chancellor Modica, because he himself couldn't get into a U.S. medical school, and he ended up going to medical school in Spain, but he had some difficulty since he had to learn medicine in Spanish, and that was not his first language. And so he ended up going to law school, but he always thought that there would be a role for an English-speaking medical school outside the United States, where students that were clearly qualified to get into med school in the United States could get into medical school and become physicians and return and practice to the United States. The reason for that is that there's about 3 times as many qualified candidates who would like to become physicians than we actually have spots in medical schools in the United States. Now the university is a comprehensive university. It has not only a very large medical school, but a veterinary school, a College of Arts and Sciences, and a graduate school. So we have all totaled pretty close to 7,000 students. Well, it addresses it in a couple ways. The most obvious way is what I mentioned before. 1% of all the practicing physicians in the United States are in fact St. George graduates. That isn't the only aspect of its sheer numbers. The other important aspect is about 70 to 75% of our graduates go into primary care fields, which are the fields that our society needs doctors to go into. That compares with only about 30% of the U.S. graduates going in those fields. In addition, St. George graduates more commonly go into underserved areas, and St. George graduates more commonly take care of Medicaid. In fact, they take care of about twice as many Medicaid patients as the average U.S. graduate. So in addition to turning out a lot of doctors, our physicians go into the fields and locations that our society needs. And I think that that is not only a good thing for St. George, but I think that that's something that U.S. medical schools should be doing more of, not just training more doctors, but training more doctors that go into the fields that society actually needs. Well, it's clear that U.S. medical schools are not very happy with the international schools. And it's interesting, they usually complain that the schools are of lower quality or they say something like they buy training slots in the United States. But the truth is we basically share our tuition dollars with the hospitals that train our students, which would seem appropriate since it clearly costs something to train our physicians, and we share those tuition dollars with them, as do most international schools. One might ask, why do American medical schools not pay hospitals, not part of their own business structure, nothing to educate medical students? It obviously costs them something to do it. And, you know, the prestige of being a teaching hospital for Harvard or Yale is not enough when, you know, those hospitals are struggling to make a profit. So we train in hospitals throughout the United States and the United Kingdom, and we basically share our tuition dollars with those hospitals, and we've had many hospitals in our system for over 40 years that have grown into outstanding teaching institutions, and in return our students often practice in those areas because they go into many of the residencies in those very same programs. No, in fact, we're very similar to a private medical school in the United States. In fact, our tuition compares with the tuitions at several private medical schools in the United States. It's also true that our curriculum and our organizational structure is virtually identical to U.S. medical schools. I know that particularly well, having just built a U.S. medical school that got accredited by the LCME. We have to get accredited by a similar accrediting body, in our case, a accrediting body in the Caribbean, that actually holds us to exactly the same LCME standards. In addition to that, international schools have to be accredited in several states in the United States in order to teach our students there. So we're also accredited in the state of New York, New Jersey, and Florida, and California, which are all states that hold a fairly high standard to international schools for us to actually do our 3rd and 4th year rotations there. So we actually have to maintain more and probably more rigorous accreditation standards than most U.S. schools.